Hi, I'm Dr. Thomas Gerber, the Associate Editor at Mayo Clinic Proceedings, who's responsible for our online and social media presence. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Today, I'd like to tell you about the Editor's Choice and Highlights articles in the February 2015 issue of Mayo Clinic Proceedings. Our Editor's Choice this month is a special article about new insights and controversies on the cardiovascular risks of testosterone therapy. Dr. Abraham Morgenthaler from Brown University in Providence, Rhode Island, and colleagues from several U.S. healthcare institutions present an extensive literature review and a critical appraisal of recent studies that had raised strong concerns about the safety of testosterone therapy. Our authors suggest that the current weight of evidence clearly indicates that higher levels of testosterone are associated with improvements of cardiovascular risk factor profiles and with reduced risk of mortality. One of the highlights in our February 2015 issue is the latest contribution to our new symposium on pain management. This article by Dr. Stephen Cohen from the Johns Hopkins School of Medicine in Baltimore, Maryland, addresses the epidemiology, diagnosis and treatment of neck pain. That should be useful for information for all of us because neck pain has an annual prevalence rate exceeding 30% and is the fourth leading cause of disability in the United States. Another highlight in this month's issue is a review article on transient global amnesia by Drs. Giulietta Arena and Alejandro Rubinstein from Mayo Clinic in Rochester, Minnesota. Much of the literature on transient global amnesia to date has appeared in neurology journals, yet any of us could encounter a patient with this condition. Read this article for an update on the diagnostic criteria and on what's known about the cause and mechanisms and the prognosis of transient global amnesia. And our third highlight this month is a special article on the founding of the Mayo School of Graduate Medical Education. This article was written by Dr. Christopher Bays and colleagues from Mayo Clinic. It was 100 years ago, in 1915, that the Mayo brothers endowed the Mayo Foundation for Medical Education and Research with $1.5 million from their personal funds. This foundation eventually became today's Mayo School of Graduate Medical Education. I can guarantee you that you will find this report from the early days of residency training in the United States fascinating. Please take the time to read it. As always, online access to these Editor's Choice and Highlights articles is free during this month of February 2015. For more information, please visit our Mayo Clinic Proceedings website. Also, check out our Facebook page and follow us on Twitter. We also post new authors' interviews and insights on YouTube several times a week. And I'll see you again in March 2015, when spring will hopefully be in the air.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.